Thinking about all those people going through that system and all those people, being processed, is there a kinder way to handle that emotionally difficult episode, or do you think it's always going to be just difficult because that information is just going to be painful, whatever? But is there a way we can improve things, do you think?
I think that in the main they have a support nurse there. I remember being extremely distressed in a very public area. I'd like to see some improvement there, really, for people who, there were people coming and going down corridor, very public, people waiting to go in and have their mammogram. You've just been pulled out and you're in floods of tears. It doesn't take Einstein to realise what that is about for those people waiting in the area. Those women have still got to go through that door, have mammograms, or they're on recall, and there's the potential they know they may be being told that news. I'd like to see some different way, really, of logistics of moving patients around so that the ones that are waiting are not having to see that, other people's distress whilst coping with their own anxiety in a public place. That's a big thing for me that I would like to change. No, you can't avoid the moment of being told. I think that at the time it would be nice to have a bit more support. I know there is a breast care nurse there, and you get taken to a room and you're given a cup of tea and things like that. That's a good thing, I think, to talk to someone and get your distress out. Some people may not react like that. I did personally. I unfortunately had the experience in my life earlier, only 3 or 4 years before that, of losing my own mother with cancer of a different type that I'd nursed. And unfortunately, from news of diagnosis to the end, because of the type of cancer that she had and because it was well advanced without us knowing about it, because of the type of cancer that it was, and an aggressive one, it was only 6 months for the whole procedure. So for me, that was a double whammy. I felt like I'd been told the same. I was probably going to go down the same route because that's all you can hear and that's all you can see. And you learn by what you've seen and heard. What you don't see is things like me, necessarily, and even in the press, in the news, the emotive stories of people who have cancer, all different types of cancer, and breast cancer. It's great that it's all out there, people going through that journey. It's a good thing that you see positive things being done, a closeness around it, a friendship of people who are battling, who are succeeding, and some that you don't. But hopefully, like for me in this video now, women out there or other cancer patients will be able to see that actually there is a scale of cancer patients, just like there is in life. But we tend not to focus on that because it's such an emotive, frightening, end of the line type word. And none of us wants to be on that conveyor belt. So basically, you focus on that without realising that in that journey, your journey may be a year, your journey may be 5 years, your journey may be 10 years. It might be 6 months, 3 months. Nobody actually knows that until you've had all the treatments and the biopsies and the scans. But at that moment when you're told that awful news, you can't think about any of that. You just think, oh, it's the end, it's all happening. It isn't quite the case. It's a little bit more tricky than that. And so, there are positives. By getting it out there, getting the right help, the support, emotional, mental support around it when you're struggling, which I'll come to in a bit, that I actually felt the need to have in my life, gets you through, and it's essential. Trying to help yourself by, if someone wants to offer to cook you a meal and you're going through chemo and your family and you're worried and you can't lift your head off the pillow, then please take it. Don't be too proud. You may have to reevaluate how you think. I had to. I was quite a difficult person to ask for help of any kind. I found it quite difficult as well, being in a semi-medical profession, working in a hospital. You know, illness of that kind, any kind, was something that happened to somebody else. I didn't deal with it very well. I professionalised it, you know, because that was the way I thought I would get through it. I actually found out that I couldn't, and that I shouldn't have done that, but that was the only way I knew how. So it is a learning curve for you, your family, your friends, but I learned along the way that it took things from me. Yeah, I lost my hair. I had to have 6 months chemotherapy. My biopsy came back. I was told initially I wouldn't need chemotherapy. It came back. It was starting to be on the move, potentially invasive. It was a grade 2, therefore I had to have chemo and radiotherapy. I remember being extremely upset when I went to see the oncologist on the first visit, but he was excellent. He drew me a graph and said, if you can put yourself through the chemo, Julie, look what you're like with chemo. And it went off the scale. You know, you've got 90% chance of this not coming back, or between 1 and 2% if you have that and Herceptin, another drug which some ladies have to have. I had to, because mine was HER positive. I had the new Wonder drug, which I was very fortunate to have at the Royal Infirmary. Negative side of that, brought back into the chemo environment for that drug to be administered. I felt mentally I'd moved on, was strong. I then found out that I couldn't actually cope very well with going back into the chemotherapy suite. I got to the point of a very negative time of my life. I had had a serious bereavement at the time I had my cancer up. I'd lost my father, and I was coping with that, and I was trying to cope with dealing with cancer, and I just felt that actually I wasn't in control of my life anymore, and I couldn't get my foot through the door with fear and anxiety. So that came as a massive shock, because I wasn't in control anymore. You know, I felt the cancer had put me in a place I didn't want to be. Luckily for me, and this is why I'm here on Cancer Stories, because it's part of the cancer process, and it's something that has evolved from the team in psycho-oncology and Dr. Alex Mitchell, that I had wonderful support. I was able to offload about my fears. I was able to be realising that the things I was feeling, I wasn't alone. I think that's part of the sadness of a cancer journey, that with all the clinicians and the hustle and the bustle and the appointments that you're going to, and the wigs you need and the anxieties and everyday life still going on, it's a bit like a fast forward film, but you're stood there watching it all happening, being directed. You can lose it, and I lost it. And I'm not ashamed to say that or acknowledge that that was part of my journey. But there is help out there, and you know, I took it, and because of that I'm here now. I'm very positive about the mental and emotional health around any serious illness, particularly cancer, because that happens to be one relevant to me, and it's a positive step that sits alongside a medical treatment. So because of that, I've made friends, I've had different viewpoints, I've been able to see positives and negatives. And yeah, I have seen patients that have been terminal in clinics, and I have been able to speak to them. And I've been able to be a much stronger person because of that. I've been able to deal with my pain, my anxieties, my worries, my cancer. But in the main, you know, I've been able to hopefully help through this medium, this video diary, the Cancer Stories, other people, you know, like yourselves, who are going through any type of cancer. I'm sure people will appreciate that, and I definitely think they'll get a lot from what you just said.